Chale, you are live now.
Okay. Very good evening, my dear viewers. I welcome all of you on this Charcha. As you all know, education Charcha is equivalent to educating the nation. In as much as we keep on inviting all the the myriad achievers from different field of specialization. As you all know, Vivekanand, author, academician, and public intellectual. Of course, the convener of Education Pe Charcha. My dear viewers, Education Pe Charcha, as you all would appreciate, is conducted under the aegis of District Talk, which is spearheaded by that of by Sri Pramodji, who happens to be a valued technical collaborator or a partner of this particular program. My dear viewers, today, we in fact have invited one of the distinguished doctors, that is a dentist, one of the best dentists of the entire Jharkhand. And his specialization of skills, indeed, it is tremendous, I can tell you. Of course, in just my dear viewers, of course, on a personal note, I do have a very intimate acquaintance with that of Dr. Om Prakashji, a very, very distinguished guest today, who happens to be heading the department of oral and maxillofacial surgery in Rajendera Institute of Medical Science, that is Ranchi. And most importantly, he has been a founder of Om Dental, who is also serving the social cause in his own myriad ways. My dear viewers, it is indeed very, very important today because it is the first time, it is the second time, in fact, we have got the dentist, we have invited dentist. And of course, Dr. Sri Om Prakashji, who is a very senior dentist, in fact, is going to reveal the various aspects and dimensions of that of dentistry. And we all know, because we happen to be laymen, from the point of view of understanding that of the medical terminologies. That is why I would like to request, our very, very valued and esteemed guest today, Dr. Om Prakashji, to be able to simplify all the complexities of the term, that what medicine encompasses. So he is the best person to explain, of course, in the very simplified ways, as to what are the areas, different areas and dimensions of that of dentistry. Because dentistry itself is just like has an oceanic depth. And that is why we invited Dr. Sri Om Prakashji basically to be our esteemed guest. Just before we kickstart the session, just one important piece of information on a very, very personal note. Once, maybe a year ago or more than that, I had developed a tooth problem. It was excruciating pain, and I was advised by a very competent dentist that I should get the tooth extracted because there was no other way out. So I straightway went to Dr. Om Prakashji, and he indeed, I tell you, he took such an initiative that I was gobsmacked to see that. Almost around 45 minutes, he fixed that particular tooth of mine, and I am still subsisting with it, or that tooth still sustains. Itself speaks volumes about overall efficiency of that of Dr. Om Prakashji, who is our very, very valued and esteemed guest on today's Education Pe Charcha, that is 79th session. My dear viewers, just a little bit introduction, because it is it is incumbent upon the part of Dr. Om Prakashji to be able to explain to us exactly the exact significance of all these degrees, because we being laymen, we don't understand the implication and the significance of all these degrees. So Dr. Om Prakashji basically is BDS. He holds these degrees. BDS, that we understand, Bachelor of Dentistry Science, then MDS, that is Master of Dentistry Science, DNB, FI, BOMS, CC, GGM, MNA, MS, all that we will of course seek the clarifications from our very, very esteemed guest, because we don't understand the implication of these nomenclatures. He is there to explain. He is currently working as in the Department of Oral and Maxillofacial Surgery and Oral Implantology. That is, of course, DREAMS, that is Rajendera Institute of Medical Science in Ranchi. So I welcome Dr. Om Prakashji. Sir, here it goes. The first question goes to you. That is, walking down the memory lane, if you could dig into your past and let our viewers know about your sophomoric years. That is your schooling years, college years, and all that. Please, Doctor, we welcome Dr. Om Prakash ji, a senior dentist. Please, sir, your take now. Dr. C. Om Prakash ji.
And thank you so much for such a nice introduction. Now, as you have mentioned different degrees, and when we mention these different degrees, probably for everyone, it will be beneficial to know what is there in different part of our education system. Like BDS, you said, it is Bachelor of Dental Surgery. Generally, this is pursued after +2 in science, which is with biology. Before that, I did my intermediate from Tata College, Chaibasa. And before that, matriculation also from Jilai School, Chaibasa. I was born and brought up in Chaibasa, which is western part of Simbhum, headquarter of Western Simbhum. So BDS, it's very clear, the persons who deal with dental problems and associated diseases and their treatment. After that, there is a post-graduation degree that is known as Master of Dental Surgery, and that I did from Government Dental College, Trivandrum. I was lucky to get twice All India, because BDS I did from Odisha, then MDS I did from Trivandrum, and that is a super specialty degree which I did in oral and maxillofacial surgery. After that, DNB, that is Diplomate of National Board. National Board is an I shall say an organization, and they give the degree to standardize it, that all those persons who have done well practically, clinically, as well as theoretically, they award this degree after a thorough examination. So after my MDS, I got this DNB. After that, when you are in this profession for more than 7 years, then you can appear for an examination, that is FIBOMS, Fellowship of Indian Board of Oral and Maxillofacial Surgeons. So this Indian Board of Oral and Maxillofacial Surgeons, they give this degree, and basically this is Association of Oral and Maxillofacial Surgeons of India. As in different part of the world, they see that those persons who want to update, they want to get recognized, so they invite applications. And when you apply for this, they again ask you to appear for examination. They thoroughly examine you. There are different examiners from different parts of the world, and after that they give this degree, FIBOMS, Fellowship of Indian Board of Oral and Maxillofacial Surgeons. That I did in 2012. After that, because I passed in 2005, so it was almost 7 years. After that, CCGGM, Clinical Course of Geriatric Medicine and Gerontology. Now, during COVID, there is one Khwaja Garib Nawaz University. They started online program, and it was again in collaboration with Indian Society of Geriatric Medicine. They started this course. So they conducted this online course, and after that they conducted an examination, and this Khwaja Garib Nawaz University, which is in Delhi, they awarded this degree of Clinical Course of Geriatric Medicine and Gerontology. Now, slowly India is getting like Japan, who has got a lot of elderly population. So India is also going to have a lot of elder populations. In fact, the more number of elders they show, you are more developed, your medical system, your social norms are better, and that's why you have got older. So we know in Mithila there is one story. One person, they didn't allow an old person to bring in the marriage, so they took that person, that old person, in a pauti. Pauti is a big box made of bamboos and something. So like that. So older persons means they are the blessings of our society, and for them we have got a different type of special. We have to cater their special needs, and we have to be trained, because the whole physiology changes as per the person gets aged. That is geriatric medicine. After that, the last degree, that is MNAMS, that is Membership of National Academy of Medical Science. That is again an decorative degree which is given to those persons who are good in medical science. They have contributed something to this medical science, and they have passed DNB, and they are teaching, they are in academics, or they are doing good works. So these are decorative degrees, which is again given by national this national board. Basically, a lot of persons, they sit together, they see your credentials, and after that they give you this degree. So these are the degrees, and I shall tell all of our viewers that when we say dentist, then it is meant that he is a general dentist. Just like when we say a general practitioner, he is my family physician. So generally MBBS or an MD medicine. But when you are talking to an endocrinologist, when you are talking to a neurologist, we not say him, he is our physician. It's just like that. When you are talking to maxillofacial surgeon, you should not introduce him like a dentist, because he has worked hard for all these degrees. I hope I am very clear about degrees.
Great, great, Dr. Saab. My dear viewers, in fact, as I already announced it just at the point of kickstarting of this session, that of course our distinguished guest is a very relevant person to talk about the implications of all those degrees, those higher degrees that of course he holds to his kitty. And indeed he has clarified now, and I think it has become now very simple for all of us, all from the periphery, or you can say all outsiders who do not have much of an insight into that of the field of medicine. And now after the proper qualification, it has become absolutely clear that he is not a dentist, but he is a surgeon, in the field of dentistry. And that is a surgeon, of course, holds distinction apart from that of being a dentist. Thanks a lot, Dr. Saab, for clarifying all that. Now I'm coming to a very second question. Since you already explained to us about Dr. Saab, we would like to know, like you to tell us something about your sophomoric years, about your childhood days. What inspired you to go for dentistry? There must have been some incidents in your schools, your colleges.
I shall tell you.
Yes.
I really, these are nostalgic memories. I shall tell you. I was a very young child. I believe I was in 5th or 6th. So like to every kid, they ask, what do you want to become? So they asked me, then I said that I can become a pilot, I can become an IAS, I can become a doctor. So then they said, ki IAS, they do a lot of things, but they are always suffocated. With all my due regards to the different fraternity, they are always suppressed by the ministers, and they are not given free hand. Then pilot is again difficult. Doctor you can become, and you can serve the government and the public, the society, the poor persons. Okay, so doctor. Now in doctor, what to become as a doctor? Sorry. So my immediate neighbor, they had been to Canada, and after that they had been to different places abroad. When they came, they said, see, Om Prakash, you wanted to become a doctor, so either you become a psychiatrist or a dentist, no third option. Why? Because see, so many good things are there. One of my school days teacher, he used to tell, if you become a dentist, you will be posted in district headquarters. Those days, these private mushrooming colleges were not there. Only government colleges were there, and 1 or 2 private colleges were there, which were standardized colleges. Not like today's, like everywhere they are mushrooming without standardization of education. So if you get this degree of BDS, you will be posted in district headquarters. But when that question of counseling came, then everybody said you take MBBS. Luckily, those days I remember my rank was 2294. 2294 in all India. That was a good rank as such. But somehow there were other places it was not vacant. So I took BDS, and it was taken in SCB Medical College. Those days it was Medical College. There I took this. And another thing was there, which again motivated me to be a doctor. He was he was my neighbor. I used to call him Charcha ji, and he was a professor of economics. So he used to tell, see, Om Prakash, there are 2 things. which is beyond rules and regulations. If anybody will hit your kid, you will go and you will fight. How did you dare to touch my kid? Hmm. If someone will stare your kid, what you will do? You will say, Ki, I will put your eyes out of the orbit. How did you dare to stare? But the same person will come with folded hand and will tell the teacher, sir, master ji, or sir, whatever, sir, you see, take care of my child. Don't refrain from beating him. He needs, then give him. But please do teach. You abuse him, but do teach. And similarly, one another profession is there, that is doctor's profession. They suppose, for with all due regards to the femininity, the divinity, for a female, modesty is the highest thing. But they will come to the doctor, they will say, Ki, okay, I am unrobing, please examine me, please touch me. For any person, if you break a tooth, that is a grievous injury. But they come to us, they pay money in private practice, or they come to us, they pay money in government also as a token amount. And after that, they request, Doctor Sahab, please, you remove my tooth. Please. For other person, if you stab someone, it's a grievous injury, it's a attempt to kill. But they come in queue that, Doctor Sahab, you give the incision, you cut my wound, you give the incision and you cure me. So whatever is wrong in the society otherwise, that becomes lawful in the hand of teachers and doctors. So somewhere in my unconscious mind, it was there that, okay, it is always good to be teacher, it is good to be doctor, and it will be best if you become doctor's teacher. Sone pe suhaga. So that inspired me a lot to be a teacher of doctors, what I am, and I'm pursuing my career.
Great, great, Dr. Saab. My dear viewers, the way our distinguished guest has explained, indeed, there couldn't have been a better explanation, because, we surrender ourselves to doctors as and when we develop some sort of pain in our body, as and when we experience some sort of nemesis. Invariably and inevitably we land up at the doctor's door. And I have seen, and whatever doctor, our very distinguished guest, Dr. C. Om Prakash tells us, I can corroborate it, I can vouch for it, because I have seen myself how when patients visit him, he has been so generously been treating them. Even from the poorest of poor class, that itself is defines the nobility of the profession of medical profession. I indeed 100% agree. Now I'm coming to the very next question, Dr. Saab. Straightway, the very next question straightway comes to you. You claim to have chaired many scientific sessions in national, international, and state conferences of oral and maxillofacial surgery and IDA. If you could kindly enlighten our viewers on the same, please, Dr.
For any fraternity or any scientific congregation, the scientific presentations are the backbone of that conference or congress. And so that is truth. That is true with our oral and maxillofacial surgery as well as dentistry. I shall tell you, like I said, first I did BDS. So that made me a dentist first, dental surgeon first. After that, I did MDS. So after that, I became oral and maxillofacial surgeon. So we attend two type of conferences. One where all dentists they come, that is IDA, Indian Dental Association. And I also attend the conferences where maxillofacial surgeons come, like Association of Oral and Maxillofacial Surgery. Different type of AO courses where aesthetic surgeries are done. There are a lot of conferences now where the maxillofacial surgeons, plastic surgeons, skin dermatologists, they come under one roof to discuss that we can give best from our side to the society. So then we collaborate and we discuss. I may be a good surgeon for bone. I may not be able to do some oculoplastic surgery, which an ophthalmologist can do. So we take from each other all good things and we train each other so that we can provide best to the society. So these are the conferences. And when we go to these conferences, now I completed my post-graduation in 2005. So it is more than 17 years. You can see my gray hairs, even they are not much in number, but that makes me senior. So generally the senior persons, they are given this opportunity to chair these sessions. And I have been associated in teaching. So that again gives an another advantages to make me different conferences. And that was from my initial days only. I was interested in academics. So generally I love to be on chair to chair the sessions and to discuss, to inquire, to moderate. And I have been organizing different, I was organizing secretary for different conferences, not from now, from my student days. We had organized different conferences and like
Some technical hits, Dr. Saab.
that I go there, I take care. Yes, yes,
Okay.
yes. Can you hear me?
Yes, yes. Now it's perfect. Yes, now it's
Can you?
perfect. Yes, yes.
Okay. So there me for years and we live demonstration of different surgeries. That person generally they in Eastern India. And Zygomatic implant. When bone is not there, we put this zygomatic bone, and that zygomatic bone we use for implants, with the help of which we can rehabilitate the denture in the mouth. So I'm the first person who started this in Eastern zone, whole Eastern zone. No one was doing. Now slowly everybody will do, but the person who starts first, they are pioneer like that. So a lot good things. I have been given opportunity like keynote sharing sessions like that. I hope I have conveyed, I have answered your query.
Great, great. So, my dear viewers, this is what exactly Dr. Saab has been doing. He claims to have pioneered, the sort of means the sort of treatment about which he has just communicated to all of us. That speaks about, his overwhelming interest not only in evolving himself as a great surgeon, but at the same time he is collaborating with other doctors, as he has just mentioned, with ophthalmologists and all that, so that a very, some sort of consensus can be evolved and a very comprehensive and a holistic treatment can be extended to the patients. Indeed, that is, of course, a pioneering in its very, very contour, pioneering in its contour. Thanks a lot, Dr. Saab. Coming to the very next question to you, because you have been so, vivid in terms of your clarification. I'm sure and certain that our viewers will be able to, today they would be lapping up all the information that you are furnishing to them, on platter. That itself makes this so very, very engrossing as well as very, very informative. Here comes the very next question, Dr. Saab. You also claim the first prize for the scientific paper presentation in oral surgery at 61st Dental Conference, 25th to 28th January at Mangalore. Apart from presenting other papers too in the process, your take on the same, please.
I remember this was long back. This conference was in Mangalore. I had just come to Ranchi. Those days I used to work in Hazaribagh College of Dental Sciences, and that paper was on COX-2 expressions of oral cancers and pre-cancers. So I had presented that now as in India, we are getting more number of cancers and same oral cancers also. So we can prevent these cancers by simply COX-2 inhibitors, means just like an analgesics. If you start taking Nemusolide, you can prevent cancer. That was my paper. So for that, I had been given the best paper award. And I shall tell you in layman's term, imagine if someone will tell you that you have got more chances of developing cancer because your family history or in anyone has got a family history of cancer, or he is taking some more onco any they have got any deteriorating habits like tobacco or something like that, where they have got a higher chances of getting a cancer. And then because they have got higher chances of getting cancer, they should start taking some COX-2 inhibitors, selective COX-2 inhibitors, celecoxib, eterocoxib, or something like that. Then there we can prevent progression of cancer or occurrence of cancer, because cancer itself leads to the whole part of body is damaged, so the quality of life is jeopardized. Person is not normal after the surgery. Now we have got so many microvascular reconstruction options, but even then, and apart from that, the expectancy of life, that is also reducing. It's not only the quantity of life, but quality of life is also compromised a lot. So if we can prevent with simple analgesic pills, if we can prevent these type of diseases, that will be miraculous. So my work was on that, COX-2 inhibitors, usage of COX-2 inhibitors to prevent oral cancers. Then that will be a new, I shall tell you, a new option. That will be a miraculous option, in fact, to prevent oncogenesis, that is cancer growth. So I was given prize for that.
Okay. Okay, Grace. Yes, Dr. Saab, can you hear me?
The how the cancer. Yes, I can.
Okay, actually there was some sort of technical hitch. No issue. So it's great, Dr. Saab, that we have come to understand that exactly the reason for which you are given the first prize. Now I'm coming to the next question, sir. You also claim to have publications in domestic ocular injury in Indian Journal of Ophthalmology and pediatric maxillofacial injuries and other studies. If you could share some details on the same for enlightening our viewers on these aspects and dimensions of dentistry. Please, Dr. Sir.
I shall tell you, there are different publications on different occasions, and these two which you have mentioned, they are really unique. That ocular injury in domestic setup, what was that case? I am a co-author for that. It was a team effort. What had happened, that is really miraculous. It didn't come in newspapers that widely, but one old lady, she was leaning on a domestic pressure cooker, and something was cooking up in the pressure cooker. So the pressure cooker busted out, and that safety valve, no, safety weight, that what we call weight, which is on the top, safety valve, no, safety vessel, which generally makes this that visual, that came out and that went inside the eye, and the eye was damaged. So that is very rare, rarest of the rare. You can't imagine the whole thing, that small top, what we see in the cooker, in the cover of the cooker, that was inside the eye, and the whole eyeball was damaged. So being a maxillofacial surgeon, I was there, oculoplastic surgeons, ophthalmologists, all the three were in the team, anesthetists were there. And then we could do that surgery, but we couldn't save that eye. But that was impossible in any part of the world. So that was published. And second one, what you were talking about, pediatric injuries, maxillofacial injuries in pediatric patients. Now, unlike older persons or adult persons, the kids, the children, they have got pliable bone. The bone is very soft. So generally, they don't fracture until unless very high amount of injury is given, or some extra injury is given, extra force is given during the injury. So that was a comparison to other part of the world, which type of injury we see in Jharkhand, in Ranchi, and that was also a statistical analysis of different type of injuries, what we face in what we see in our day-to-day practice.
Great, Dr. Saab, great. So now we are stated because Dr. Saab, actually, since you gave a very, I would say, one of the very finest examples of that particular, the cooker pressure busting, and that on the lady, she got that eye affected, and then entire eye was absolutely jeopardized. It could not be retrieved. And so it was one of the examples where three of the doctors collaborated from three different, backgrounds, collaborated to save that particular damaged eye. So could you cite some other instances also where you collaborated with the doctors of other department, in case of curing somebody's, some part of to the teeth or some other part of the body, where your role too was pivotal, apart from the roles of other doctors? Any other example if you could cite?
Well, very, very commonly, our branch is associated with ENT, plastic, and neurosurgery, ophthalmology. These four branches are very closely knit. Like whatever we do, that is below the brain, cranial cavity. So if the trauma is there and if forehead is fractured, there are a very fair chance that the underlying brain, the gray matter, is also at risk. So we work in collaboration with neurosurgeons for all these frontal bone fractures or cranial fractures, because we are supposed to be better in osteosynthesis of craniofacial region. Like orthopedicians, they do limb fixation very nicely. They are master of that. So similarly, our training is best probably for osteosynthesis. Osteosynthesis means broken bone correction. Just like, luckily I have got something to show you persons.
Yes, please.
Like this, if you see this. So if this is fractured, if you see, these are different type of small implants, and they fix it in such a way that it will be back to normal. And we are supposed to master of this. I believe, yes. Like this, if you see. So our mastery is in this. But along with this, we do a lot of oral cavity procedures. So in day-to-day activity, in day-to-day our business practice, we see so many oral cavity. So we are supposed to be the master. I should not say the best persons, but we are better in oral cavity procedures. So slowly we started doing cleft lip, cleft palate. Not only me, the whole branch. We started doing facial surgeries, scar revisions. We started doing orthognathic surgery, by which we could change the whole face. So in all these things, sometimes these collaborations are with our own fraternity persons of different specialty, like orthodontists. When we do orthognathic surgery, we get collaboration with orthodontists. They guide us how much bone we are going to cut and which type of occlusion we are going to get. Similarly, when we do implants is a surgical procedure. Just I was showing you the zygomatic implants. Now I put the implant. After that, the tooth has to be fixed. The teeth, the denture has to be fixed. For that, prosthodontists, they come, they help us. Similarly, for restoration, there are endodontists, conservative dentists, periodontists are there. So we take help of everyone. Similarly, from the other branches, like I was telling, like we do the fixation of the bone of the orbit, and some oculoplastic surgeons, they help us in getting better closure of eye or aesthetic corrections. And the most collaboration what I have done is with neurosurgeons. Then second, with oncosurgeons. Sometimes they call us for reconstruction. Then with plastic surgeons, sometimes with ENT surgeons also. So like this, sometimes we take help of orthopedic surgeons, like we have to harvest the iliac crest. And I remember I also harvest myself, but initial days, my HOD sir, he used to tell, he say they are best in their work because they do day out, day in. You will be doing once in a month or once in 6 months. So why not to ask them to do it? So that is the way. There are two type of possibilities when you are going to operate. One, there is no other chance. So whatever option you have to do, you have to do, because you have to save life. There, no one is going to come from London to do something good. So whatever best you can do, you have to do. Sometimes you have got an option. You have got at hand a person who can be better than the person who is sitting in Leeds, London. So we shall see always for the welfare of the humanity. Tadhang sang pravakshami lokanang hit kamyaya tasya vijnana matrena sarvagyatang prapadyate. Thinking of the welfare of the persons we can achieve. So like that we collaborate.
Great, great, Dr. Saab. My dear viewers, Dr. Om Prakash ji, who is gracing and blessing today's Education Pe Charcha, also has a moodings in Sanskrit, because you have seen the way he has recited at ease the Sanskrit slokas, that itself speaks a volume about his moodings in Sanskrit. That is why he is a doctor with a firm footing in that of ancient Bharat Barsha. That makes him a very holistic surgeon. Because even I am an outsider, I don't have any knowledge about science or even about medicine, but I know, visiting the ancient India, the science of ancient India was so much evolved, and whoever has the moodings in that science obviously will have a greater, say, the mindset, or will have a greater maneuvering skills, as even in the field of medicine. So therefore, Dr. Om Prakash ji is a brand ambassador of ancient India science, along with the blending of the modern science, that what gives him a sense of perfection, a mastery in in the field of this surgery in teeth. I myself have experienced it. The way I was experiencing the pain, and so effortlessly, he just cured me, which a doctor had suggested that it should be straightaway extracted, itself bears a living testimony of the degree and the magnitude of efficiency that he epitomizes, that too at an ease. That makes him a perfect surgeon. Yes, Dr. Saab, coming to the very, very next question now. It's very important. You also claim to have made several scientific presentations. If you can share some details pertaining to the same without, just to enlighten our viewers, your take on this, please.
See, I have presented more than 100 presentations. Must be much more than that. I had opportunity to present in international, national, as well as state, district forums and different places. So what should I tell? Basically, this is everywhere. The science is very vast, and everywhere we talk, whatever the newer things comes, how we improve our techniques. Like I have presented on orthognathic surgeries. Orthognathic surgeries, these are the surgeries to make a person beautiful, basically beautiful, handsome. And that can be done at ease. In Ranchi also, probably I am the first person who started orthognathic surgery, and they gave wonderful results. Can I have some photographs of orthognathic surgery? So I can show you. It must be on some papers. I will show you. So I presented papers on that. There is a term called oral myiasis. Oral myiasis is maggots in oral cavity. That is a very disgusting condition. When the person is not able to handle his oral cavity hygienes, he is not able to even move his tongue properly, and then the flies, the domestic flies, they come inside and they make they lay down the eggs, larvae, and after that the maggots, they start walking in the mouth. So that is known as oral myiasis. I have presented on oculocardiac reflex. When we do the surgery near the eye, then suddenly the heart rate and blood pressure goes down. I basically got best papers, awards on all these, what I am talking of. So I presented on one ocular melanoma was there, for which I got also award, for which we had to accentuate the whole eye. So these type of different presentations are there, and then we have got now. I spoke on some legal issues. Legal issues means suppose a person die in the clinic. Generally, a same person who is going in the bus and he is dying in the bus, no one is going to challenge the driver or conductor. Same person, if he dies waiting inside a private dental clinic, that will be a big news. Patient died in doctor's chamber. Or sometimes there are some persons who want to harass doctors. They will tell doctor killed the patient. Why should a doctor kill a patient? Doctor should never kill the patient. Even he wants the money, then also he will not kill the patient. And if he does not want money, then also he will not kill the patient. So I keep on talking about all those things, those good things, because basically doctors, they say or they don't say what they want. They want the first thing, that the pain of the patient, the sufferer, should be relieved. I remember Raja Rantidev's one sloka is there. Na tvaham kame rajyam, na swargam, na punarbhavam, kame dukh taptanam praninam artinashnam. For any doctor, that is the motto. They don't want the kingdomship. They don't want to go to heaven. They don't want to get free of moksha. Na mokshasya kancha. That is what they want. They want, the first thing is that the pain of the person, the sufferer, should be relieved. After that, as a byproduct, they get money, they get name, fame, and sometimes they get kingdomship also. Now the Chief Minister of Tripura, he's a maxillofacial surgeon from our fraternity. So, okay, these things can come on the way. So I keep on telling all these things. Now recently I had one paper what I presented, the temperament of the surgeon and the outcome of the surgery. Have you seen a pilot who has not slept for less than 8 hours? He is not supposed to fly, isn't it? But have you checked a surgeon that he has slept well before doing surgery? Is there any criteria? We don't have. We don't have. A surgeon, he might have a fight in his home with his wife, and after that, whatever the anger is there, that will come on the patient. That should not be there, because temperament is temperament. If you start abusing me, my voice also will get loud. Generally, I'm talking in a general practical terms. You are standing in a queue and someone coming and abusing you, you will get perplexed, and if he continues, you may start reverting it back. So is there any organization or any guidelines that, okay, if surgeon is not feeling good, he should not operate? No, persons will thrust. Oh, you are in government, you don't want to work. You are a government servant. We face this day to day life. We have to prepare a lot of paperworks are there, like you said, researches are there. We have to take classes, and in between some student will come. No, you have to do this work now. Otherwise, we are going to complain. And the public will tell also, hey, doctors, they don't want to work in government setup. You go to private, they will work. In private, if someone has done 3 surgeries, after that he is feeling sleepy, but someone will come, then he has to work. Why it should be? Because you cannot maintain the quality then. So these are finer things, but someone should raise voice that the person who is not good, he is not feeling good, he should not be compelled, because someone's life and death issues are there. So on all these topics, I keep on talking all over the India whenever I get opportunity, and I keep on talking about sometimes about the spirituality part also, because that makes you a perfect person. Because until unless you have understood this, you cannot say Ma bhaishta viddhasta nastapaya sansara sindhos taranastapaya tameva yata tame Ma bhaishta viddhasta nastapaya sansar sindhastarnastapaya yeneva yata yatayasya parang tameva margang tava nirdishami. Don't get afraid, O learned one. I shall tell you the path. There are ways. Nastapaya. Upaya has not finished. There are ways. Like other persons, they tried and they got it. I shall also tell you. To a teacher only can say like that. And to be a teacher is a tough, it is a really tough job. It's not that easy job. In any time it was not an easy job, and even now it is not an easy job to be a good teacher. So I
Great.
keep on talking like this, like a teacher.
Great. Great, Dr. Saab. My dear viewers, you have seen that, normal dentists that we come around, they basically do not have much of exposure. Here, our distinguished guest, apart from excelling in his curriculum, he teaches both BDM, means at the graduation of dentistry as well as the post-graduation. And that has devolved upon him the sort of vastness of knowledge which is communicating with the sense of ease, and that all of us have been witness to the very simplicity of the ways of his communication, that even we laymen can understand what he is trying to make us understand. This makes a teacher, only a teacher can explain with so much, with the sense of vividness and the sense of clarity as what we have seen our honored guest today has been articulating from this podium with that sense of clarity. Thank you, Dr. Saab, for giving us such a plethora of information. You are dishing out plethora of information for good of all our viewers who are logged in with us as of now, or who eventually view this video, because one of the, I would say, the best dentist, or rather one of the best dentists of Eastern Zone we are hosting on Education Pe Charcha. So there can be no dearth of the vital information just getting inundated at this very show. Thank you, sir. We are just coming to the next question, Dr. Sir. You have been intimately connected with social activities, giving talks in radios, TV, on educating general mass, on dental and maxillofacial topics, even donated blood for poor patients and did other social works. If you could kindly elaborate, on the same, to for our viewers to have an insight into all that, please, Dr. Sir.
We have been involved in different type of this type of activities. Like I shall tell you, we conduct one cycle rally, Swami Vivekanand Swasth Jeevan Shaili Cycle Yatra. Swami Vivekanand Healthy Lifestyle Cycle Rally. In that, we several doctors, medical students, we start from one place and we go to other place, like longer distances, like from Jamshedpur to Ranchi, from Bikaner to Jodhpur, from Ayodhya to Lucknow, like that, longer durations, from Delhi to Haryana. And in between, wherever we go, like some schools are there, colleges are there, so we already inform them, and we go and we teach students. We try to share whatever our knowledge is there about healthy lifestyle. Now I shall tell you, long back persons were dying of malaria, plague, and all those infectious diseases. After that, persons were dying of deficiencies, malnutrition, kwashiorkor, marasmus. Now persons are dying of diabetes, blood pressure, all these things, depression. All these things are lifestyle diseases. If we can change them, long back when we were students, heart attack, myocardial infarction used to be a disease of older persons after 50 years. Now, undergraduate students at the age of 20, they are getting myocardial infarction, heart attack. So, we are getting rich, refined diets. Initially, persons used to take sugarcane. I remember going to different fairs, mela, and we used to get sugarcane, and we used to take it raw. Now, I don't think, except Chhat, they don't get to see sugar canes. They will get sugarcane juice. On every nook and corner, they have got this. The food habits they have changed. Initially, you could have got samosa, jalebi almost in every town or villages. Now you will get pizza, chow mein shops, and this all they have changed the food habit patterns, our lifestyle, which is not always good. Which is not always good. So we go to like I said on cycle. Then we collect some persons. We say them how to eat. They should eat good food. They should have some routine daily physical activity. They should have some prayers also. It's not mandatory that you go to Shiva temple. Whatever you believe in, you go, you pray, because health is not only mere physical absence of diseases. It's a complete well-being of physical, mental, and social status, and now spirituality has been added to it. So for our physical health, we have to do exercises, we have to eat well, we have to keep our hands clean, our nails should be trimmed, like small things we keep on telling. Then bad habits should not be there. We know tobacco, it was imported from outside. We don't have Sanskrit for tobacco, but everyone is having exposure to tobacco. So if everybody goes on bicycle, how much petrol we will be saving, how much pollution we will be able to control, and we will be giving some employment to the poor cycle repairing workers. So this type of things we do. Then we conduct several camps. Like I had an opportunity to go to Pakistan border several times, Kashmir, Srinagar, and different villages, Bugam and Rajouri sectors, different places where what we see, where bombings and all these things used to be there before 370. And those days we used to go through NMO, through NMO and Seva Bharati and different organizations. We used to go there, we used to stay there, we used to conduct camp, we used to talk to them, we used to try to tell them what will be good for their health overall. Similarly, this northeast area, we had been to those places also. So on different camps, and we used to conduct camp, and after that we used to educate them on health, not only healthy lifestyle, about other parts of the health also. So these are the different activities. Then we used to, not only I have donated, we have conducted several blood donation camps where several unit of bloods we have collected. Now probably every 6 months or sometimes once in a year, I donate regularly. Sometimes more than that also, because after 3 months I can donate. So sometimes twice also in a year we have donated. So not only me, a lot of my friends, they do routinely donate blood. And this type of small activities, whatever possible, we do.
Great, Dr. Saab. I'm just coming to the penultimate question, because after this there'll be just one more question. Dr. Saab, your hobbies inter alia includes writing Hindi poems, touring places. So if you could just let our viewers know the places that you have toured thus far, I mean to say the special places, which normally normal people do not tour. And then it is just for the sake, because let our viewers know that a doctor even nurtures some sort of interest in writing poems. Because just before the session I was just telling you that even our former Prime Minister Mr. Vajpayee was a great poet. So you being a doctor, you nurture some passion, which of course makes you something special. So therefore I would like to request you on behalf of our viewers that if you could just recite 1 or 2 lines of the poetry that you have penned thus far. Please sir, your take now.
Okay. Now in this situation where so much of workload is there, now poem is very difficult. Now it must be a prose. But even then, if you have said, I had written one, Aag ko na bujhne dena, aag ko na tum bujhne dena. Basically, this is inspired by a lamp. When we say Atma Deepo Bhava, like you become a lamp. So basically, it was depicting that. I don't remember exactly line by line, but it was something like
Some voice is cracking. Dr. Saab, we are not getting your voice.
को पानी से भी बुझती है आग, ज्वाला मांगे अनुकूल परिस्थिति, जैसे गीत मांगे सुंदर राग, आग को ना तुम बुझने देना. So even if you want to sacrifice yourself, then also conditions are not always favorable for you. Like for a lamp is only giving you light. It's taking heat, it's taking all the darkness on its own head. But then also, if too much of air is there, wind is too much, then also it will not remain. If wind is not there, if air is not there, then also it will not remain. If too much of ghee is there, then also you will not be able to burn it. If ghee is not there, then also you will be not able to burn it. So like that, this poem was there. I has written it somewhere. I have to collect it, but the theme was like that. And
Good.
about visiting different places, in this small program, it's I really enjoy visiting places. Let it be
Well,
like recently before COVID, I had been to Netherlands to see Hollandum. In my early days, my teacher used to say, "Ki those persons, they are so hardworking that they have vacated their place, the sea level. They stay below their sea level, and they have got windmills." So I had an idea that okay, I should see that place. So I went to Holland. I went and I attended a surgery training also on temporomandibular joint surgery. And after that, I had seen those places, how they cut how they carve this diamond. I had an opportunity to visit Belgium, Brussels, Paris, like that. And in India, different places means every nook and corner we have got beautiful, wonderful places. uh, you have to explore it. Like from my home where I stay in Ranchi, from there hardly 2.5 kilometers, there is a very small mountain, one small river. No one is there because they don't know. That's neglected. But you can go there, you can have a very nice natural feeling, that typical the sound of flowing water, chirping of birds, and all these things you can enjoy it. So even when I was in Odisha, small places like Hanuman Prasad, the small remote areas where the mountain, hilly areas where the river they start, or some basins of the river, I used to go all these places, and I really enjoy these nice places. Nearby, we have got one of the big water body, that dam in Burla. Just forgetting the name. Hirakud Dam. Hirakud Dam. So whatever place, wherever you go, nearby Kake Dam is no way inferior. Hatia Dam, everything. Rukka Dam, Hundru Waterfall, Jona Waterfall. Everywhere it is good. Even nearby we have got Saktipet, not Saktipet, Rajrappa. It's a very out of Das Mahavidya, uh, one where basically all the Das Mahavidya Mandir temple is there. So if you go there, on the way you can see the scenic beauty. How this two rivers they join, the Damodar and Bhairavi. You can enjoy everything. So
great.
I love visiting places, in fact.
Great, Dr. Saab. Fantastic. We are just coming to the last question, sir. It's very, very important because you are the best person to, to be able to articulate, or rather able to emphasize on every single term that I'm just going to narrate to you for the understanding of our viewers. You claim to have your future interest in the following areas. That is maxillofacial trauma, orthogenetic surgery, onco surgery, and then maxillofacial implantology, and craniofacial deformity correction. So if you could just in a one or two lines explain all this, sir, please.
Maxillofacial trauma means any trauma which is in facial region. That is very common day to day. Persons, they go without seat belt, they drive bikes at high speed without helmets, they take alcoholic drinks, and after that, and we see persons in very bad shape, they lose life, and we have to prevent it. And if they have suffered, we have to correct it, and it's a very challenging job. Recently I was invited to Patna, being a president of my society, Bihar Jharkhand unit, branch of AOMSI, Association of Oral and Maxillofacial Surgeons of India. I was a speaker on this only. So that is maxillofacial trauma. We should prevent it, and if it happens, we should be able to give it back, the whole face, like I had shown you, the whole face, even if it is crumbled, we should give him the face, they deserve the face back, they deserve it. Then orthographic surgery, as I had told you, that it's a beautification surgery. Like if you see, you will understand it better. If you see this, can you see this?
Yes, 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 yes.
So this
Yes.
is pre-operative, post-operative, like this.
Right. Yes, yes, yes.
So pre
Great.
and post, it looks, that is orthographic surgery. Basically, here in Bihar, Jharkhand area, a lot of girls are there. They are not getting married because of poor appearance of their face. So this skin dip beauty, though we say it is skin dip beauty, but then also it is required in real world. And this can be done. Initially, when I was not trained for this, I was not aware that these things can be done. So a person who looks like I had shown you in the picture, can you imagine? This type of face can be converted with small surgery. So that is a boon. So that is another passion. Then oncosurgery, persons who suffer from cancer. So a person who is dealing with oral cavity in day-to-day basis, they are equipped to treat it. So oncosurgery, if I do, I can give a better quality of life. We can rehabilitate in a better way. So that is another passion. Then what was last? Craniofacial. Whenever there are pathologies which is starting from cranium and it is deforming the face, like different type of syndromes are there. We say it Cruzen syndrome, craniofacial dysostosis. It becomes large, this becomes frontal bossing is there. So we require a team effort, and it requires a lot of interest, enthusiasm to treat these type of cases. And of course, I want to do these things for a better humanity, I shall say.
Dr. Saab, I have just one question. Do you think that all that you've explained, especially changing the the structure of the face, it means beautifying the face, doesn't it have a side effect, means negative or adverse side? What do you suggest?
No, there is no negative side effects. So whenever we do anything, we basically titrate it, that how good effects we are getting and how much negative impacts we are getting. Suppose if you are getting desired effect almost 80 and some pain, some suffering is there, that is 10, then this is good. We don't consider it as a negative impact. Fact is that. So any big surgery, there will be swelling, there will be some bleeding, some pain, but that will last only for 15 days, 1 month, not more than that. But after that, what we get, that is marvelous. That is marvelous. And fact is that I don't know why the media persons, they don't understand, the general persons, they don't understand. I had given articles in the paper, in radio talk also I had given, but persons, they don't understand that these facilities are available and these are miraculous. We need to go, and fact is that no, this has to be shown. One side effect I shall tell you, because these are big surgeries, so we require anesthesia, we require hospitalization. So this cannot be done on roadside or in a dental clinic on day-to-day basis. But persons need to know about this. Until unless the persons, they know about this, how will they take the benefit?
Great. Great. My dear viewers, today we have had a wonderful Because just I had my own skepticism or some sort of apprehension, and our esteemed guest today, Dr. Om Prakash ji, had allayed all my apprehension and the sense of skepticism. Even if you go for beautifying, your face through all the medical care that what Dr. Sahab just now prescribed and articulated, obviously it doesn't have any negative fallouts, because that might prevent someone from going ahead with this sort of treatment. They should feel rest assured that it is not going to have any negative impacts or negative fallouts. Thanks a lot, Dr. Sahab. My dear viewers, it was a wonderful, a spectacular session where plethora of information has been dished out, that too from an expert who happens to be the best dentist in the Eastern Zone, one of the best dentists in the Eastern Zone. And we have heard from him, explicating on the various aspects and dimensions of that of dentistry. So indeed, I would like to prescribe that, those who will view this video, they indeed will be the beneficiaries. My dear viewers, before I invite Sri Pramod ji, just to make an announcement for translating our very, very intellectually scintillating as well as a very simple conversation, keeping in view such a complex medical terminologies being so much simplified by an expert, it indeed was a very, very simple conversation. That means simplification of the complex conversation. My dear viewers, we have just to make an announcement that next session we have we have Sri Durga Das Gupta ji. He is retired government or central government law officer. He is going to be our next guest on coming Saturday. That is 28th of January. And now it is a time for Sri Pramod ji to share his own opinion and the transcript of our intellectually scintillating conversation with a distinguished Dr. Om Prakash ji. Yes, please, Sri Pramod ji now.
नमस्कार। आदरणीय विवेकानंद जी और आदरणीय श्री ओम प्रकाश जी, इस चैनल के माध्यम से आज हम लोगों ने व्यावहारिकता में तो दैनंदिन संपर्क में चिकित्सीय व्यवहार में हम लोग रहते हैं। प्रत्येक घरों में दांत का और शरीर का कोई न कोई रुग्णता के लिए, सलाह के लिए अपने चिकित्सकों से संपर्क करना पड़ता है, लेकिन इतनी गंभीर जानकारियां हम लोगों के पास नहीं रहती। उसमें कितने विभाग हैं, उन विभागों की क्या कार्य हैं और उनके कार्यों की सरलता किस प्रकार से हो सकती है। प्रारंभ के दिनों में जो डॉक्टरों का दर्शन होता था हमारे भी परिवारों में और कहीं भी जो डॉक्टर होते थे, बड़े सरलता से एक सामान्य से उनके कक्ष में जाकर के उनसे बातचीत करके एक छोटे से पर्चे पर लिख करके दवाई लेकर लोग चले आते थे। अब ये स्वरूप बदल गया है। हम लोग बीमार पहले होते हैं तो इस बात का निर्णय करना पड़ता है कि यदि आप किसी निजी क्लिनिक पे जाना चाहते हैं तो पहले उनके यहाँ फोन करिए, टेलीकॉलर से बात करिए, एसएमएस करिए। वहां पहुंच गए तो रिसेप्शन पे जाइए, रिसेप्शन में फिर पैसा जमा कीजिए। आप डिजिटली जमा करेंगे कि करेंसी जमा करेंगे, फिर बैठिए, भले ही डॉक्टर साहब अपने चेम्बर में गेम खेल रहे हो, फिर आपको बुलाया जाएगा। चिकित्सीय प्रणाली सफाई सुथरा के साथ साथ बड़ा कठिन हो गई और सामान्य लोगों के पहुंच से बहुत दूर चली गई। केवल सरकारी चिकित्सालयों में लोगों की पहुंच तो होती है, लेकिन डॉक्टर की सहजता ना हो तो उस पहुंच के बाद भी क्या स्थिति बनती है, मुझसे बेहतर ओम प्रकाश जी जानते हैं। और ऐसी परिस्थिति में यह गौरवान्विति देने वाली बात है कि हम लोगों के बीच डॉक्टर ओम प्रकाश जैसे व्यक्तित्व मौजूद हैं, जिन्होंने बड़े सरलता से चीजों को कहा। और इतनी बड़ी जिम्मेवारी आप अध्यक्ष के रूप में हैं, आप सेमिनार में सेवा देते हैं, सेवा भारती जैसे संस्थानों के साथ जुड़े हैं, एनएमओ में आपका समय जाता है। जाहिर है, मैं एनएमओ के साथ रहने वाले के आंतरिक हृदय में राष्ट्रीयता और राष्ट्रीय तत्व तो होगा ही। ऐसी परिस्थितियों में जिन सरलता के साथ, जिन सहजता के साथ और जितनी तन्मयता के साथ हमारे झारखंड की राजधानी के इतने बड़े राजेंद्र इंस्टीट्यूट में आप जैसे लोग हैं, क्या हमारे लिए गर्व की बात है। और हमारे दर्शकों और हमारे श्रोताओं के लिए, जो अभी देख रहे हो या इसके बाद जो संपर्क करना चाहें, उनके लिए ये बड़ा अद्भुत अनुभव होगा। हमारे और आपके बीच में जो ये चैनल का ये 79वां अंक चल रहा है, इसमें आदरणीय विवेकानंद जी के द्वारा जो श्रम दान किया गया है, या जो बौद्धिक प्रकल्प के रूप में इसको खड़ा करने का एक अभ्यास उनका चल रहा है, यह बात तो सिद्ध हो जाती है कि समाज में जो बौद्धिक चिंतन करने वाले राष्ट्रीय तत्वों के साथ जुड़े लोग हैं, वह तो समाज के पहली पंक्ति से लेकर अंतिम पंक्ति तक के लोगों की चिंता करते हैं। लेकिन समाज के उन वर्गों तक पहुंचने की जो एक घेरेबंदी में रहते हैं, जैसे कि अभी हमारे देश के सभी अखबारों ने देखा कि रांची में एक खुलता हुआ अच्छा सा अस्पताल पर किसकी नजर लग गई कि वो जांच के घेरे में खड़ा हो गया, और एक आईएएस ऑफिसर्स को कई महीनों तक कृष्ण जन्म स्थान का दर्शन करना पड़ा। ये ठीक है, न्यायिक प्रक्रिया चल रही है और कुछ न कुछ उसमें होना है, ऐसा नहीं होना चाहिए। लेकिन एक मन में प्रश्न खड़ा होता है, जितने सहज और जितनी सरलता के साथ डॉक्टर साहब की एक बात को मैं रेफर करूंगा कि डॉक्टर साहब जब अपने मास्टर से मिलने गए थे, तो मास्टर साहब ने इनसे कहा था कि देखिए, दो ही प्रोफेशन अच्छा है, एक टीचर का और एक डॉक्टर का। तो डॉक्टर का प्रोफेशन इसलिए अच्छा है कि डॉक्टर को अपने प्रोफेशन के समय चिकित्सा के संदर्भ को देखते हुए किसी भी परिस्थिति में रोग ठीक करना है, रोगी के प्रति संवेदना या रोगी के प्रति मोह नहीं रखनी। वैसा ही शिक्षक के साथ था कि शिक्षक को विद्यार्थी ठीक करना था, विद्यार्थी के माने बिगड़ने की संभावनाओं को कम करना था। लेकिन अब ये दोनों परिस्थितियां बदल गई, और इन दोनों बदली हुई परिस्थिति को इस राष्ट्र के लिए ठीक करना इसलिए आवश्यक है कि 10% लोग ही वो ऐसे हैं जो उस घेरेबंदी में रहते हैं, बाकी 90% लोगों को भाग दौड़ का सामना करना पड़ रहा है और कठिनाइयां हैं। मैं समझता हूं कि आज का यह जो अंक है, इस अंक में मुझे 2 उपलब्धि मिली। एक तो डॉक्टर ओम प्रकाश जी की सरलता का दर्शन हुआ। आप इतनी विद्वता को हासिल करने के बाद, इतने ज्यादा अनुभव रखने के बाद भी सरल, सामान्य और सहज रूप से चिकित्सीय व्यवस्था में लगे हुए, और जिस प्रकार से विवेकानंद जी ने चीजों को सामने रखा उससे ये अनुभूत होता है कि उनका भी दांत बहुत सरलता से ठीक किया गया है, जिसकी उन्होंने चर्चा भी की। मैं समझता हूं कि देश के दो ही चीजें ऐसी हैं, एक चिकित्सा और दूसरी शिक्षा, जो दोनों अभी प्रश्न के घेरे में। शिक्षा की ऐसी स्थिति है कि डिग्री बांटी जा रही है, और चिकित्सा की ऐसी स्थिति है कि इन्वेस्टमेंट किया जा रहा है। सुपर स्पेशलिस्ट हॉस्पिटलों की बाढ़ आ गई है, और वहां भी भीड़ है, और लोग बुलाए जा रहे हैं। तो ऐसे परिस्थिति में जिस प्रकार के चिंतन को लेकर के एजुकेशन की चर्चा चली है, मुझे पूरा यकीन है कि इसमें भी हम जैसे लोग, विवेकानंद जी जैसे लोग, ओम प्रकाश जी जैसे लोग लगातार तन्मयता से लगे रहेंगे, तो इस राष्ट्र का निश्चित ही एक प्रकल्प खड़ा होगा, और हम लोग भी अपने राष्ट्र को परम वैभव में ले जाने पर सफल होंगे। मैं समझता हूं कि 16 मिनट का समय बहुत ज्यादा हो गया है। विवेकानंद जी मुझे बोलने के लिए समय नहीं देते हैं, 10 मिनट 12 मिनट का समय देते हैं, क्योंकि 8:06 में उन्होंने मुझे बुलाया था। मैं समझता हूं अब दर्शकों के लिए इतनी ही बात काफी है, और इस ऊर्जावान चैनल के प्रति मेरी सभी लोगों से प्रार्थना होगी कि आइए इस चैनल को हम राष्ट्रीय स्तर पर लोगों को सुनने के लिए बातें करें, उनसे निवेदन करें, इसको सब्सक्राइब करें, और कुछ बौद्धिक चेतना की ओर लौटने का प्रयास करें। क्योंकि ये अंतर्जाल में जो संचाल है, इसका जो संजाल है, इस संजाल में जो चीजें हैं, उसका सिलेक्शन करने का मन हमारे पास नहीं रहता है। और यदि हमारे पास इसके चिंतन करने का मन नहीं रहेगा, तो हम किस प्रकार से काम कर सकते हैं, इसको सोचना होगा। आप सबों का बहुत बहुत धन्यवाद। मैं अपनी वाणी को विराम देता हूं, और आगे विवेकानंद जी को।
Thanks a lot, Prabodji, for the expression of your erudite views, like opinion. My dear viewers, indeed, it was a spectacular session, and I know I'm so much.
इसको हमको जाना है एक जगह,
to our
चार बार फोन कर चुका है,
for enlightening all of us on such a complex issue, as that of medical science. Indeed, my dear viewers, just to make just to reiterate an announcement pertaining to our next guest, Sri Durga Das Gupta ji is going, law officer, retired law officer from Union government. He is going to be the next guest on next Saturday. And, with this announcement, I once again acknowledge with a sense of appreciation, for our distinguished guest, Dr. Om Prakash ji, for educating all of us on dentistry and on all the various aspects and dimensions of dentistry. I would like to make an invocation to all the viewers to log into this particular, today's video, today's program, and get enlightened on different aspects.
वही बीच में आके अध्यक्ष जी फोन करे चला, तो हम रिमोट में चलो हैं, 2 दिन उनका फोन आयल रहा है, लेकिन हम उनका रिस्पॉन्ड नहीं कर सकलिए। धन्यवाद हम एलो लेट सर, एखन छी धन्यवाद में।
Thank you. Thanks to viewers, please. Thank you. Disconnect. Thank you. Thank you. Pramod, disconnect.
हाँ, तो कमिटी के जे मीटिंग हेते तो ओई में तो हमरा कोनो जगह नहीं छे, तो वो मीटिंग में हम की करिए?
Pramod ji,
ना
Pramod ji, disconnect.
संजय जी कॉल है ना।
Pramod ji, disconnect करिए।
हाँ, कहीं छी तो विश्वास करो क्या कि नवका कमिटी में उनकर कहब छले ने जे पिछला सत्र में अहाँ जे छे कतो गेबे ने के लिए एकोटा मीटिंग ने अटेंड के लिए तो अहाँ के नहीं बजाल जात।
प्रमोद जी डिस्कनेक्टेड। प्रमोद जी डिस्कनेक्ट करिए। प्रमोद जी
मेंबर वाला में ठीक है, पर
प्रमोद जी
संगठन सचिव के पद तक क्रिएट कैल गेल रहे, लेकिन क्रिएशन के बाद बहुत लंबा समय तक जे छै से